Hello everyone. In the name of Allah, I start this video. I'm Isra, student of OSH State University International Medical Faculty, and I am in 5th year. I'm here to explain you about acute circulatory failure or circulatory shock. This is my self-individual work guided by our teacher Asil Murzabek Kizi. I'm thankful to her for giving me this opportunity to compile information regarding acute circulatory failure. Definition. It is defined as the life-threatening, generalized form of acute circulatory failure with inadequate oxygen utilization by the cells, resulting in cellular dysfunction as a result of dysoxia, that is, the loss of physiological independence of oxygen delivery and oxygen consumption associated with increased lactate levels in organs such as heart, brain, liver, kidney, and GIT. The failure may be due to hypovolemic or distributive causes. A large range of medical conditions can cause circulatory failure. These include but are not limited to surgery, particularly on patients who have lost blood, cancer, especially lung cancer, severe dehydration, blood clots, including the use of some platelet activating factor drugs in some humans, drugs that affects blood pressure. Types of circulatory failure: hypovolemic shock, vasogenic shock, cardiogenic shock, obstructive shock. First is hypovolemic shock. It occurs due to low blood volume resulting in decreased cardiac output. Depending on causes, this shock is divided into following types. Hemorrhagic shock, which results as an internal or external blood loss due to ruptured blood vessels. Dehydration shock is due to dehydration, circulatory blood volume reduces. Traumatic shock is due to trauma or injury which produces severe pain which inhibits vasomotor center in medulla oblongata. Vasogenic shock. It occurs due to toxic substances released by pathogens which leads to successive vasodilation within the vessels. Depending upon causes, vasogenic shock is divided into following types. Neurogenic shock occurs when nerve decreases sympathetic vasomotor tone and increases in vagal tone. Anaphylactic shock refers to acute allergic reaction in which large quantities of histamine releases. Thin histamine causes vasodilation of blood vessels, leads to shock. Septicemic shock is a condition in which bacteria circulate and multiply in the blood and form toxic products and causes high fever and vasodilation. Cardiogenic shock. It occurs due to decreased pumping ability of the heart because of cardiac abnormality. Causes of this shock are myocardial infarction, cardiac arrhythmia, congestive cardiac failure, obstructive shock. It occurs due to impairment of ventricular filling during diastole due to some external pressure on the heart, due to decreased ventricular filling stroke volume, and hence cardiac output decreases. Causes of this shock are pericardial cardiac tamponade, means bleeding into the pericardium with external pressure on the heart. Pulmonary embolism, that is, embolus formation occurs in the pulmonary vein so that no blood reaches to left heart. Stages and clinical features of shock. Depending upon severity, circulatory failure is divided into three categories. First stage or non-progressive shock. It is also known as compensatory shock, in which body try to compensate the loss of blood to vital organs with few mechanisms like rapid compensatory mechanism, intermediate compensatory mechanism, long-term compensatory mechanism. Second stage or progressive shock. Here, compensatory mechanisms are not able to stop progression of shock, and some positive feedback mechanisms occur which can lead to serious damage. Third stage or irreversible shock. All treatment becomes ineffective and patient dies due to severe tissue damage to the vital organs of the body. Signs of shock: dyspnea, chest pain, dizziness, decreased urine output, thirst, nausea. Symptoms: sunken eyes, low blood sugar level, dry tongue, cyanotic lips, weak pulse. Treatment: in general treatment, patients should be kept in cold because exposed to warmth can cause sweating, which can lead to hypovolemia and aggravate shock. Raising foot end of the patient bed by 6 to 12 inches, which helps in promoting venous return and cardiac output increases. Replacement therapy: in hemorrhagic shock and burns, whole blood or plasma substitute like dextran can be transfused. In hypovolemic shock due to dehydration, balanced electrolyte solution, that is IV ringer lactate solution, can be given. Sympathomimetic drugs helpful in neurogenic and anaphylactic shock where either sympathetic tone is low or vasodilation is present. Drugs like dopamine should be used. If it is not available, epinephrine can also be used. Oxygen therapy, little bit helpful because it relieves hypoxia. If you have any questions on this topic, kindly ask in the comments section. Thank you for watching. See you in my next video. Bye-bye.